come back. So you've heard these music tones that were on you, correct?
Pardon me?
I do this on my videos. I talk to people that have headphones on and they can't hear me, so it's ridiculous. You can, you've heard that music now, right?
Mm-hmm.
Okay. So we're going to come back and recheck these muscles with that on, okay?
With it on?
Yeah.
Okay.
We can take it off, actually. We'll just show that it's...
That's fine.
Let's take them off. So that didn't hurt too much, did it?
Mm-mm.
So now we're going to come back and recheck the muscles on this side, okay?
Okay.
So I want you to bring this leg up like you did before. Hold it straight. I'm going to push down. You hold it straight up. Hold your leg out towards the wall. I'm going to push down this way. You hold your leg right there for me, okay? Remember how this arm didn't hold in very well last time?
Mm-hmm.
So hold it in now. I'm going to pull out. You hold your arm into your side. Ready? Try and hold it. So that worked better. Then your hand here, it's been pretty sore, right?
Mm-hmm.
So I want you to keep your eyes open. Look at your hand. So I'm going to push down on it now. Last time this didn't feel very good and you didn't want me to do it again, but I'm going to do it now anyway just to show you the difference. You try and hold it right there. Yeah, but it helped, didn't
It was
it?
better.
One more time. Hold. And this is still going to be weak here because I haven't set that tendon in your arm yet, so you can see this. Now normally we don't set this right away till we do some other things, but I just want to show you how this will strengthen this up. You got to bend your elbow here.
What are you doing?
Out of trust here. I'm going to take this long head of the biceps
Yeah.
and set it back into the bicipital groove here.
Okay.
The reason this slips is because you get uninhibited flexion, because when your extensors aren't firing, they don't inhibit the flexors, and then you get too much pulling of your shoulder like this forward all the time.
Mm-hmm.
And we're going to fix that for you. We're going to roll on the inside here. Count a little bit. 1, 2, 3, and 4.
How lovely.
You did good. I'm just going to fast stretch this a few times to inhibit flexors. Now you hold your arm up this time. I want you to push up towards the ceiling. Ready? You know why? Because you can now. Try it again. It's holding better, isn't it?
Mm-hmm.
I wasn't just faking that, was I?
No, you're not.
Now I'm going to push over this way too, and I want you to hold it right there. I'm going to push this way. Hold your arm right like that. Good. So what we've done now is established some pathways here to start firing better, which is activating your muscles. We're going to be doing some other things now too to increase what's called proprioception. And we're going to make some very specific corrections on your hand and your feet to send proper afferent information back to your brain to make your muscles start to work better.
Do you have any idea why this happened?
It can happen from overuse, like you do all the time. So as compared to my marathon runners who are always out doing this, you're always working your arms and hands.
Well, and see, the thing is musicians are notorious for not paying attention to what you don't think about your body while you're doing the music. It's like you're only thinking of music, and then you realize, oh my God, I'm in pain.
Right. And we see this all the time in our athletes.
Mm-hmm.
I just don't work on that many musicians. I'd like to, but anyway, it doesn't matter who you are or what you do. We see these problems all the time. So Jim told me the Minnesota Twins came in and his left side would be down all the time because he hit left-handed.
Mm-hmm.
So he put a lot of stress onto his side, and you're doing it right side.
Yeah.
So this is the side that, and we're going to actually, when we're done here, we're going to take you into our gym and show you neurologic exercises you can do with your eyes and so forth. That will, you can do those before you play, and it'll stop this from happening.
Seriously?
Yes.
I will send you lots of my violinist friends, I can tell you that.
So
And composer friends.
we're going to have you start turn over for us.
Okay.
And so you, even after we get you in balance, you're still a little sore, but that's due to the inflammation. We have some things to get rid of inflammation.
Feels better. I can at least move it. Oh,
Face down.
all right.
I'm going to put this board under your hips. And your hands can go right here on the table. Can you breathe there?
Yep. My low back,
It's sore too.
yeah, just,
That's part of the whole deal.
Okay.
So we're going to put these wedges on you. They're called SOT wedges. And we're going to put on very specific positions in your hips.
okay,
By setting these in a manner that will actually bring your pelvis back into balance, it's going to start sending proper proprioceptive information back to your brain, which is going to activate all your paraspinal muscles here and start to make your hips fire better too. Okay? And this doesn't hurt very much, does it?
no. Just warn me before you're gonna do something, I like to know.
Alright, I'm going to pull on your foot right now.
Okay.
So what we're doing is fast stretching the side that's got too much flex or tonus on it to reduce those flexors in the tonus state. And then we're going to do some flexion on this side to help reduce flexion on this side, okay? It's called a cross extensor reflex pattern. Go grab that vibration.
Is this technically kinesiology?
Smell that? Yeah, it is.
No, I don't want
But
it.
it's also functional neurology.
Yeah, because Naomi works a ton with that whole nervous system.
That's what it's all about.
Yeah.
And that's why on your back here, the muscles on this side too have been failing.
Yes, they have.
So that makes it harder for you to play all your instruments so far, because these stabilization muscles back here aren't stabilizing your shoulder, so then it's putting too much tension on the front part of your shoulder too.
So I'm going to ask you a weird question. So does it matter how you sleep? Because
No,
since all of this
just don't
started...
sleep on your stomach.
No, I never do. But since I started having these problems, it's like my shoulders and everything just collapse in when I'm sleeping. And I wondered if that was making it worse.
It's not making it worse, it's just that your support system has been lost. That'll get better now. Take a deep breath in. Your sacrum's moving good on this side. It's important. And we're going to test your hip on this side. Hold your arm strong. Right now I'm just testing for imbalances in her hip. Because the muscles have been weaker on this side, her hip actually has shifted into a position where it's coming more internal. And it's shifted more in an up position. These blocks help to bring this whole pelvis back into balance. This creates a whole torque on the whole dural system, which goes from the sacrum and comes up all the way into the cranial vault. And so it'll cause a overall body torquing on the system. So we're going to have you lie on these blocks for a few minutes, and then we're going to do some vibration percussion on your feet too, okay?
Okay.
So let's do that right now.
These two fingers right now are really numb and still.
Yep. It's because you're too tight up in here. We're going to be loosening up some of those muscles on you. We're not going to leave you like this forever. Right now he's putting a specific vibrational pattern into your feet, which is following up very specific spinal tracts here to activate the receptors in the brain to make your muscles start to fire better, okay?
Okay. So how much of this have you kind of developed or integrated yourself, and how much of it is just standard?
It's not standard. It's advanced chiropractic that we learn in neurology and kinesiology. The neurology degree is an advanced degree. And so what you do is learn to target all these different pathways to make sure you get optimum results.
Well, the thing I was telling you about on my right foot, I had this, this, the doctor called it a bursa on my right bone, and he gave me a shot of cortisone.
And see, the reason that's happening is because you've been getting too much tonus here, which is causing increased pulling on your Achilles tendon and tightness in the plantar fascia of your foot. And so the cortisone It's like putting a Band-Aid on it. It works for a little bit and then it
I know.
We're gonna get you turned over in a minute. Put your fingers over the end.
Okay.
When I push down and pull back, I want you to pull back with your hands a little bit, okay?
Both
Breathe
of
in,
them?
pull, yep. Let it out. Breathe in and pull. Let it out. Breathe in and pull. Once more. We're just going to use a drop piece on your sacrum just to get it a little more active here. Breathe in.
Whoa.
Now we're going to have you turn over for us. Roll over. You're doing good. Now we're going to have you sit up for us.
Oh.
There's an area right here in your mid-back where your T6 vertebrae is, and by activating this, it's going to make these muscles in your back start to fire better, okay?
Okay. Do I?
Got to give yourself a hug. You deserve it after coming here. This is very simple. Don't let your head fall back. Keep your chin tucked.
Take a big breath in. Let it all out and fall back with me. Nice, nice and easy. Just fall back. Good. That chin tuck. Good.
Now you can lie back down. Just going to take a quick look at your pupils here. I want you to look at my big nose. You get a lot of headaches too?
No.
That's a good thing.
I sleep with one of those neck contour pillows.
Mm-hmm.
Before I started doing that, I've been doing it 5 years. Before that, I was having problems with my neck and my head.
Okay, can I have you that percussive there? So we're going to loosen up some of your flexor muscles here, which will help when you lay down not to get more numbness down here. And then we're going to work on a muscle that actually comes across your arm here called a pronator muscle.
So you don't work as much with the nerves. Like Naomi, she puts pressure, slight pressure on the nerves. Wow.
We work with the muscles.
You know what?
We work with the nerves and the brain down.
Yeah.
I want you to take your arm, push down towards the floor. That up. Push down towards the floor.
That is so where it hurts and is sore.
It's been that way for a while.
It's been that way for a long time.
So you get kind of chronic inflammation in there.
So,
I want you to, I'm going to do this with your hand. I want you to push against it. Okay?
against you?
Yeah. Good. Does that hurt your hand too much?
Only when you squeeze me right there.
I won't squeeze you there. You just
Okay.
push against me. Good. We'll just do this instead.
Okay.
We got to get the inflammation out. You can't. Rome wasn't built in a day.
Yeah.
It took 2 days.
That's the problem too.
And we're just going to do some fast stretching on these muscles just to get them to let go here for us. Okay?
What does that mean?
I'll show you. You fast stretch a muscle that's too tight, it causes it to relax. All we're going to do is this. We're just going to do quick stretches like this. These flexors are way too tight in your neck here.
Yeah, they're really tight.
And they put pressure on your brachial plexus coming out here too.
I do stretching exercises, but they don't seem to be enough.
So in order to get your neck looser, we're actually going to take you into our gym and do eye exercises and head turns, and that'll help us loosen up, okay?
All right?